Time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Narula. First up, peanut allergies. According to the CDC, just 8 foods or food groups make up 90% of all serious allergic reactions in the U.S., and peanuts are one of them.
This week, the National Institute of Allergy and Infectious Diseases published guidelines on how to prevent peanut allergies in children. John had a look.
4.5-year-old twins Audrey and Isa share everything. Everything, that is, except Isa's severe peanut allergy. When Isa was diagnosed as a baby, her mother Chai Kuo was given traditional guidance.
No ingestion at all of peanuts and no contact either, because she had a contact allergy where if she so much as even touched peanut, she would break out into hives everywhere.
But when Isa's brother Ander was born last year at high risk for peanut allergy, the plan was reversed. Chai was told to feed him diluted peanut butter on a regular basis starting at 4 months to avoid developing an allergy.
He's been able to have it 3 to 4 times a week at home with no adverse reactions. So it's a big sigh of relief for all of us.
Now we're saying not only it's okay, we're saying go do it.
Dr. Hugh Sampson of Mount Sinai Hospital helped write the new guidelines.
In these high-risk children, we need to get peanut into their diet early to try to prevent peanut allergy.
The guidelines categorize high-risk babies as those with severe eczema, egg allergy, or both. Introducing peanut protein is now recommended as early as 4 months old. This regimen lowers the odds of developing peanut allergy by at least 70%, leading to the new guidelines.
I wish something like this would cure peanut allergy, but it's unlikely. I think we can significantly reduce the amount of peanut allergy.
John, do these new guidelines surprise you? Because I think for a lot of people, 4 months seems really early.
Well, they surprised me 2 years ago when the study came out showing this, so I was expecting these guidelines, and it shows you why you need to do these studies. But I want to bring up something that's been of concern to me the last few days. You've been seeing these headlines that have been talking about giving peanuts to kids and even pictures of bowls of peanuts. Peanuts are a choking hazard,
yes,
especially for babies, for infants, and for young kids. And so that's why in the guidelines they take special care, right? To talk about how to give it safely. You take maybe peanut butter and give hot water.
Thin it out.
Thin it out, give a slurry. So I really think that's important. I don't want people out there, especially young parents who maybe don't know any better, to do something that's wrong.
Just to hand over a peanut. What about other food groups, Tara? I mean, could they expand this to approach allergies with those?
So food allergies are a big problem. They affect 4 to 6% of kids in America. They result in hundreds of thousands of ER visits. There's no cure. So being able to find a way to prevent these allergies would be a big deal. And there are only about 8 foods that are cause of 90% of food allergies. So theoretically, it makes sense that you could do the same thing with other foods that they're doing with peanuts, which is basically introduce it into the immune system early on in life at a time where you can recondition the body to react in a different way to these allergenic proteins. They're doing this already with egg and milk. So far, the egg studies have been small, and they've had conflicting results. Some have shown benefit with early introduction, some haven't. Some of the research are saying that maybe we need to introduce those 2 things even earlier than 4 to 6 months to really see a benefit. So the bottom line is we need a lot more research into this, but definitely opens up the door to that possibility.
It could make life a lot easier for young kids in schools where they have all the bans on bringing any kind of peanut product in there, if they could change things like that. We move on to the next topic, which is the incidence of cancer. This week, the American Cancer Society put out new estimates for the year 2017 using data from the National Center for Health Statistics. The report estimates that this year there will be over 1.6 million new cancer cases and over 600,000 deaths. But in a positive trend, the report did find that from 1991 to 2014, the overall cancer death rate dropped by 25%. Tara, were there differences in these statistics when it came to men versus women?
There were. So let's talk first about the similarities, right? They're the top 4: lung, colon, prostate, and breast. These are really the ones that most affect and are the biggest killers of men and women. But there is a disparity there, and that comes in the fact that men are affected or have a higher incidence of cancer in general, 20% higher incidence incidence than women do. They have a 40% higher mortality rate than women do. And there are differential reasons why this might be. First of all, men are more affected, for instance, by liver cancer. That happens to be a very fatal type of cancer. There are other cancers that more often affect men and can be more deadly for men: esophageal, laryngeal, bladder, and melanoma. Some of the reasons why we might see this difference, in addition to some cancers being more fatal, are differential exposure to environmental risk factors, or things like smoking or alcohol, which many men may do in more excess than women and can contribute to certain types of cancers. There may be hormonal differences, and even things like height have been shown to influence the development of cancer.
John, what about other demographics?
Well, in 2014, the cancer death rate was 15% higher in blacks than in whites. And we've seen this kind of disparity for years. We know, I'm a gastroenterologist, we know, for example, with colon cancer tends to affect blacks at an earlier age, and when it affects them, it's more aggressive. We know that the most deadly form of breast cancer, triple negative, affects black women higher than other groups. So this is something that we've known about for years, and we've thought we need to do something about that. Now, there are a number of factors, maybe genetics, environment, and then, of course, access to care. The good news since the Affordable Care Act was from 2010 to 2015, the percentage of uninsured blacks was cut in half, from 21% to 11%. And the problem right now is, with the threatening of the Affordable Care Act, is that going to change and maybe not give you the opportunity to make some changes?
Some of those are things we know. Were there any things in these statistics that might surprise people?
There were a couple things. So first of all, cervical cancer was the second leading cause of cancer death in women ages 20 to 39. And that doesn't have to be the case. If there's better screening, if there's more acceptance and use of the HPV vaccine, that could change. We know that in 2014, only 40% of girls ages 13 to 17 got the HPV vaccine. Other things that stood out, there was big geographical differences. So heart disease is the leading cause of death in this country, but in 21 states, cancer is the leading cause of death. And when you compare states, Kentucky had 3.5 times the rate of lung cancer due to higher smoking than Utah. And finally, there are cancers that are on the rise, like liver cancer and uterine cancer.
All right, great information for all of us. Doctors Jon LaPook and Narula, thank you very much.